This fictional case study explores various components of person centered therapy, and the article that it's pulled from explores transpersonal psychotherapy. But for the purposes of this video, we're only going to be focusing on person centered therapy as applied to the conceptualization of bulimia nervosa. It's a made up case, so it's not an actual or real case. But it is a really good case example because we'll get to look at how psychotherapeutic treatment for an individual who's suffering and experiencing bulimia nervosa will look like. So we'll talk about some of the concepts from this. We'll call the therapist Nicole and we'll call the fake client Janice. Bulimia nervosa is a complex eating disorder that's characterized by recurrent episodes of binge eating and then purging. More specifically, it is a disorder that involves the hasty consumption of a large amount of food, followed by some type of compensatory behavior, such as vomiting, fasting, excessive exercise, with the intent of thwarting whatever possible weight gain might come from all of the binging that the person just did. So let's discuss the therapy approach for a minute. In Rogers person centered therapy, a client's strengths and resources are used to foster self direction and the ability to accept responsibility for their actions. Incongruence, which is, according to Rogers, manifested as psychopathology, develops when a person's external values are not in line with whatever his or her internal or inner experiences or feelings are. Conditions of worth often arise when children, for example, perceive that certain aspects of themselves are negatively evaluated by someone they consider to be important. So, for example, if you as a parent say something to your child and they perceive it as negative about themselves, they could essentially internalize that. Discrepancies often arise between a person's real self, so your actual lived experience, and our ideal selves, whatever that version is, which leads to this incongruence. Basically, imagine, if you were to visualize a cliff, this is your ideal self, and you picture yourself. This is your real self, but you picture this ideal self of who you are, and there's this divide. So, this approach depends on the therapeutic integration of the core conditions of congruence or genuineness, empathy, and unconditional positive regard in order to build the client therapeutic relationship. And we've talked in previous videos about how important that is in terms of change in therapy actually occurring. A typical treatment protocol focused on achieving these three core relationship conditions in therapy is demonstrated in a verbatim located a little bit later on in the video. So basically, we'll see a little bit of dialogue, or you'll hear a little bit of dialogue between Janice and her therapist. So let's get into the case. Let's find out a little bit more about Janice. So, Janice is a 25-year-old woman who has struggled with bulimia nervosa for several years. This disorder began quite innocently when Janice, at 15 years of age, decided that she wanted to get rid of a few pounds, very typical for a teenage girl, I would say, in this day and age. And so she and her friends engaged in this weight loss competition. And before long, this became Janice's primary focus. She became very obsessed with body shape, with her weight in particular, with how she looked. And it seemed that all Janice really wanted to talk about during those years was what her calorie intake looked like, and really focusing in on working out and being very active. As a result of the competition, Janice lost 10 pounds. By the time she was 16, she was at a healthy weight, but in Janice's mind, she was not thin enough. So she would look at herself in the mirror and think, I need to lose weight, even though she really didn't need to. Due to her negative feelings related to her body weight, she experienced low self esteem and began to avoid social interactions, even with her closer friends. So she's becoming avoidant, she's starting to withdraw. And as she continues to focus on the shape of her body and her weight, she decided to really start to restrict her daily caloric intake. So she really started to decrease the amount of food that she was eating. She would only eat an apple or maybe drink 2 diet sodas or eat carrot sticks during the day. Definitely not enough for somebody to live on and be, a healthy, functioning human being. Of course, by the evening, she was famished. And this is when the binge eating patterns really started. By age 17, she would pick up her own groceries once a week on her way home from school or from work. These food items often included crackers, chips, peanut butter bagels, peanut butter bagels, chocolate bars, which she would keep and she would hide in her room. And after her restricting or basically not eating all day, she would come home and she would be starving and she would go into this kind of binge phase where she would just eat all of the secret food that she had, stored away in her room. And her binging episode would usually last about 30 to 45 minutes. And during that time, she would feel out of control, like she couldn't control her eating, like she couldn't stop eating. And it was pretty typical for her during that time to consume 2,000 calories during an episode. So she goes from not eating at like anything all day to just, basically stuffing her face. And then of course after a binge she would feel, guilty, and the guilt would just consume her. She felt so ashamed of her behavior. And so that's where the binging pattern begins. And so then she, after that, she would feel like, okay, I have to do some type of compensatory behavior. Essentially, I have to do something to lose all of the calories that I just ate. And so that results in either she would engage in some type of self induced vomiting or excessive exercise. At the time, it was, it wasn't difficult for her to get into being able to really work out because that was supported by her family. But at the time, it was difficult for her to engage in any type of self induced vomiting in her home. It would kind of seem weird if she was constantly running to the bathroom. Her family might start to wonder, like, hey, are you okay? What's going on? And so she, became really creative. She developed a system that worked for her. She would have bags stored in her room. So when visiting the bathroom was impossible or seemed like, all right, well, I just went to the bathroom, I can't go again. She would, without raising suspicion, she would vomit into a bag and then dispose of the bag later on. I already kind of talked about how her family was had habits of exercising, and so for them it was very normal that she was very physically active, teenage girl, and it didn't seem abnormal that she worked out as much as she did. However, in addition to her going to the gym or her family seeing her working out, she would also perform hundreds of push-ups or sit-ups in her room, not long after a binging session. So again, that compensatory behavior. And her cycle of binging and purging went on for several years, although the severity of the symptoms varied at times. At one point they kind of disappeared. Kind of typical for teenagers. She's maybe focusing on other things, focusing on after school activities or what her friends are doing. And so, those symptoms kind of maybe came and gone a little bit. By the time she was 18, she shared her struggles with her family doctor, who recommended that she see a psychotherapist at an eating disorder clinic. It was then that a formal diagnosis of bulimia nervosa was given to Janus by the clinic's consulting psychiatrist. At that time, she then, went ahead and shared the secret with her parents. And after seeking help in the form of weekly cognitive behavioral therapy with a psychotherapist from the eating disorder clinic, Janice went into full remission. However, around her, so she started to do better. She was doing fine. Around her 22nd birthday, though, she experienced a breakup with her boyfriend, and all of her former symptoms returned even stronger than before. So the binging and purging started up again. Initially, it was twice a week, and then, by the time she turned 24, she was binging and engaging in the compensatory behaviors very regularly, and it would take place 15 to 18 times a week, so multiple times a day at that point. Although her weight remained normal, she began to experience, difficulties and health issues. Menstrual irregularity began to occur. And she finally withdrew herself from the university that she was going to because it was becoming such a problem and an issue for her. At which point, she was placed at an inpatient program at a hospital that was close by, which lasted about 3 months in terms of the program that she was going to. This was very beneficial for her. Overall, the course of the program, over the course of the program, she was, able to focus on the symptoms. She was able to diminish those symptoms, and eventually, Approximately 1 month after the completion of the program, she again went into full remission for a second time. So that's good. She's starting to get better. She's improving. At this point, she's 25 years old and she's been out of the inpatient program for 3 months. Although she remains symptom free, she is, these recurring dreams and frequent thoughts about binging and purging, which is probably pretty normal because it's been a significant part of her life up until this point. She's also struggling with issues of self worth, and at times she feels ashamed of her behaviors. She believed that, at her age, eating disorders would have been conquered. She wouldn't have to deal with them anymore. They would be something that were in her past, not something that she would be dealing with as a 25-year-old. She sometimes pretends that she's completely fine and fully healed, and she tries to convince her family members and friends that because she went to this hospitalization program that she's fine. Very typical. She wants family members and friends to be proud of her, to be proud of the fact that she, is fully recovered. And typical, you don't want family members to worry about you. Oh, I'm fine, everything's okay, everything's good. Um, and so there's maybe some denial there, which we talked about in a previous video in terms of some defense mechanisms going on there. She decides to return to school following her inpatient treatment, so she's trying to kind of put her life back together, pick things back up. She reported being inspired by one of the university's professors. And so, even though, she'd been raised Catholic, she hadn't really been practicing for many years, but she, started to explore the religious and spiritual side of things again. As she, she's kind of going through, a very tough time as she starts to experience and question the meaning of life, the purpose of her own life, as she continues to be consumed with these pervasive thoughts about her body shape and her weight. In the last couple of weeks, Janice embarked on a spiritual search for the answers to these questions about her existence, the meaning of her life, and she reports feeling called to something greater in her life. And after speaking with a good friend, Janice decides to seek help, but this time she wanted something different. She'd been to the clinic and she'd experienced that, but she wanted to take a different approach, try something else, which is also very normal for clients where, all right, I've had this type of therapy or I've experienced this approach or this program, let me try something else and see if that will work. And so she sought a psychotherapist and ended up seeing someone for person centered therapy, which is what we're talking about today. And she hopes, as part of this therapy, that she'll be able to kind of figure out what's going on. Of course, she wants to break free from the psychological imprisonment that she feels like she's experiencing because of these negative thoughts, and the continued desire to engage in these behaviors. And she hopes to work on severing the ties that this disease has caused on her mind, on her body, and on her soul for the past several years, as it's been something that she's been fighting at this point for several years. So she's highly motivated to move on. So now let's look at the case conceptualization. From a person centered perspective, the client is experiencing conditions of worth, right? We talked in the case presentation about her self worth, and of course, she's also experiencing some incongruence. She's fully aware of how her parents worry for her well being, and she wants them to be proud of her. She feels as though her recovery is contingent on this fact. Her complete recovery from bulimia nervosa is a condition of her self worth. So essentially, in her mind, she's come up with, I don't have self worth unless I am fully recovered from bulimia nervosa. Now, anyone, who hears that can probably think about that and challenge that thought. Like, well, you have worth as a human being, regardless of what, if you've got depression or anxiety or whatever it is, you have worth because you're a human being. But she, in her mind, has tied these two things together. Therefore, in order to earn her parents' approval, their pride, and at times even their love, Janice pretends that, everything is wonderful in her life. We talked about the defense mechanism. And she's opted not to mention her dreams and reoccurring thoughts of binging and purging to her parents because she doesn't want to disappoint them. She doesn't want them to worry. She reported that sometimes she does such a good job at convincing others of her wellness that she even fools herself. And this incongruence, so in person, I keep talking about defense mechanisms because we've talked about that in a previous video, but here it would be, again, that incongruence. It manifests itself between Janice's real self and her ideal self, which we talked about a few minutes ago. Although symptom free in terms of behaviors, Janice's real self continues to struggle with some of the residual effects of bulimia nervosa. This is evidenced in her dreams and thoughts about binging and purging, including her feelings of shame and her issues of self worth. Her ideal self, however, is quite different. Janice's ideal self is completely free of eating disorders or concerns regarding that issue. Freedom from this illness is something that she has hoped for and expected and really desires. She understood in person centered terms. Regarding person centered terms, she believes that her ideal self would no longer be consumed by these pervasive thoughts regarding body shape and weight, and that she would instead be liberated from them. So, now let's look at one of the sessions and some of the dialogue. So, this is session 5, and the following dialogue highlights Roger's core conditions of congruence and congruence of empathy and unconditional positive regard. This is Janice's 5th visit, as I just mentioned, and already her and the therapist have, created a strong bond or a strong alliance. Today, Janice seems to want to discuss issues related to her incongruence along with her desire to find meaning in her life.
Welcome back, Janice. It's so great to see you again. Come in and make yourself comfortable.
Thanks. It's good to be here. I'm a bit frustrated, though. I still find myself oscillating between what I call my head and my heart and what you named my real and ideal self last week. I want to be that person who is free.
I hear what you are saying, Janice. I understand how difficult this must be for you. I urge you to be gentle with yourself. I think you are doing a fantastic job. Remember that you have lived with bulimia nervosa for a long time, and therefore reaching your ideal self, a self who is healed and free, will take time. It's a process. I am here to journey with you.
I know that you believe in me. I think that inspires me to come back here each week, and what you say makes sense. I guess I just get impatient with myself. You were right, though, when you spoke about baby steps last week. I suppose I should celebrate my baby steps. Last night, I was honest with my mother when she asked how I was doing. I didn't wear a mask, for once, and instead told her that I had been consumed by negative thoughts and was having a tough day. She simply hugged me.
Congratulations, Janice. I'd say that's more like a big step. Good for you.
Thank you. It felt so relieving to express how I was feeling.
What was that like for you to speak that truth and to be loved for it?
It was difficult and scary, but I'm happy I did it.
It sounds like you took a pretty important first step, despite your fear.
Well, I suppose so. Oh, yes. I also wanted to tell you about my course on Tuesday. My professor spoke once again about finding meaning in our lives. My thoughts began to race. I felt both inspired and doubtful. How can I find meaning beyond this disorder?
I see the strength that is within you. Over these past weeks, you've often referred to the things that inspire you. You have spoken about a stirring within you and a sense of awakening to something greater. Trust in yourself.
That's hard when I'm feeling worthless and ashamed. It's such a paradox.
I realize that, Janice, and I see the paradox too. Next week, if you like, we can practice a few disidentification exercises to help you realize that just because you have a thought or an emotion doesn't mean that you become one with that thought or emotion. There is so much more to you than this eating disorder. I am here to help you find your greatness within.
You saw identification. Janice will assume responsibilities for herself and the consequences of her past choices. In the process, she will then develop greater autonomy and self determination. And through cognitive reattribution, for example, the therapist can assist Janice in shifting her perspective. More specifically, Janice will be able to consider her past and current challenges. So, for example, the pervasive thoughts that she's been experiencing about the binging and purging, and she'll be able to see those from more of a growth mindset versus a fixed mindset. So be able to see it as a learning experience as opposed to, a really negative situation that she's been through. This will help release some of that shame and guilt that she's experienced and that she has now associated with these painful events, and hopefully promote freedom and compassion within herself. In essence, the goal at this stage is to support Janice as she shifts from some of those negative patterns of self invalidation and starts to focus more on the positive, as well as starts to have a hopefully a more positive attitude about herself in terms of self acceptance, and even holding herself accountable as she, tries to be more positive about everything that she's experienced. Disidentification. So, Janice will confront questions of purpose and meaning in life and learn to disidentify from relationships and emotions associated with the ego. In this case, she will learn to disidentify from shame, from worthlessness, and from her relationship with her eating disorder. So, there's a lot of things going on there. Through disidentification exercises such as I have my emotions, but I am not my emotions. This can be, let me pause here. This can be really helpful because a lot of times, clients experience so much emotion and we kind of really get tied into our emotion without being able to take a step back and say, okay, well, I exist and these are my emotions that exist, kind of, yes, our emotions are internal to us, but I am not my emotions and my emotions are not me. So being able to disidentify from those. Janice will begin to tap into her inner strength, her wisdom, her resources. I think previously we've talked about our clients all have resources and strengths, but sometimes they forget that they have those strengths and resources. And with time, Janice will begin to recognize that she is so much more than her eating disorder. And that by letting go of that identity, she can create an inner space in which she may welcome and embrace new meaning, new purpose for her life, and that will shape a revised or a new identity for her. By disidentifying from the eating disorder and all the shame that she has associated with that, Janice will also begin to recognize her own inner resources that will help shape her changing self concept. So, in ending, healing from bulimia nervosa is a process that takes time. Similarly, embarking on a journey to find new meaning and purpose in life and discover inner strength and resources is also a demanding and time consuming process, right? Anytime we want to work on self development, that takes time and energy. Janice and her therapist will meet once a week, and the way forward in terms of treatment will, of course, be the client's decision. Essentially, the ball is in her park in terms of how much work she wants to put in, the direction that she wants to go in therapy, the things that she wants to work on, etc. Depending on her clients, her motivation, her openness to different processes, her openness to healing and growth, and maybe pushing herself outside of her boundaries a little bit. All of those things again can take time, sometimes months, sometimes years. Every client is different. That's all that I've got for this case. If you guys want to see more about this case, or if you want to see other cases in the future, experiencing and getting exposure to different presenting concerns or different therapy approaches, let me know in the comments below. Thank you so much, guys. Have a wonderful day.